Hello everyone, this is Dr. Khosla. This is a short video that explains what is a worldview, including the difference between individualism and collectivism. So think of the common phrase that we look at life differently. Your friends might have said this to you after you had a discussion on some topic in which you had different perspectives, or you might have heard it in a movie, or just maybe have heard somebody say this. So we look at life differently, can also be said that we have different worldviews. So a worldview is like a lens through which you view things. You may not be aware of the lens, but simply be aware of what you are seeing. So worldview is like an unseen lens through which you are seeing the world. And depending on how our lens differs from that of somebody else's, our worldview could be different. So, worldview is a complex construct or a complex concept to get your head wrapped around. But you can think of it as a sum total of beliefs, assumptions, ideas, values, motivations, and so on. The beauty and also the complexity is that it's mostly unconscious. Everyone has a worldview, but we may not be aware of what our worldview is. So, what affects our worldview? Our respective worldviews are affected by religion, by culture, by the assumptions that we make about human behaviors. How do humans behave? Why do humans behave in a certain way? And these, in turn, are again affected by culture and religion, and family upbringing and the values and beliefs that our families hold are also a strong predictor of our worldview. In fact, children have worldviews too, and that's because despite not having a lot of life experience, they still have experienced family upbringing, and hence their worldview is shaped by that of their family. However, a worldview is not constant, it can change over time, and that is because as time passes, we have new experiences. So, if you expose yourself consciously to more and more different experiences, the chances are that your worldview might shift from what it used to be previously. So, why is this concept or construct of worldview important? It's important because depending on your worldview, you interpret life in a certain way. This means it affects how you think, it affects how you feel, and then our thinking and our feeling in turn affect how we live our lives day to day, or in other words, they affect our actions. And that's why worldview is important. Now, there are a few key dimensions along which worldviews tend to differ. The first one is time orientation. So, Western cultures tend to be a little different than Eastern cultures in this respect. In the West, time is considered to be linear. The universe is understood to have a beginning and will end. So, it's very finite. There's a beginning, there's an end. In the East, for example, in contrast, the idea is that time is cyclical. There's no beginning or end of the universe, the cycle keeps on going. And that can have an effect on how people interpret what is happening. It can have an effect on healthcare as well. For instance, Eastern cultures might believe in reincarnation, and that is in some way linked to the idea that time is cyclical. And so, birth and death might be just viewed as 2 points in a cycle and not the beginning or the end. And that might affect how people choose to have certain healthcare treatments or not. Now, another aspect of time orientation is that Eastern cultures, Eastern cultures are basically cultures based in different parts of Asia, tend to be past oriented. So they honor traditions, they honor their elders, they honor what used to be, whereas Western cultures tend to be future oriented. And this can also affect our health. So, for instance, using traditional remedies because this is what the elders used to use, or this was what was used in the past, might be a common feature of some Eastern cultures. In the West, behaviors that will lead to results in the future might be valued. So, for instance, exercising now so that you can be healthier in your old age, or going in for screening for common health disorders, or screening for other health issues so that you can catch diseases early and be healthier in the future, are examples of health behaviors that are actually affected by this time orientation and might be practiced more in the West. Now let's look at space. Now, overall, and again, these are all broad generalizations that I am making in this video. Overall, in the Western world, physical space tends to be valued more than in the Eastern world. So people tend to stand closer, work closely in Eastern cultures as opposed to the Western world. But again, these are broad generalizations because depending on whether you are in a social setting, whether you are in a professional setting, the amount of space people keep amongst themselves might differ. Again, there is some understanding that Europeans tend to stand and sit closer than the Americans. And this is important for healthcare because how far the healthcare provider, for instance, stands or sits from the patient can cause comfort or discomfort to the patient. So, if you are from a culture where people tend to sit or stand more closely, and the healthcare provider is sitting or standing at a distance, that person might appear to be cold or condescending or unfriendly. In contrast, if you are more comfortable with people maintaining more space and the healthcare provider is closer to you, that might cause a feeling of discomfort that your space or your personal boundaries are being violated. And so that's why there are these differences. I beg your pardon. That's why space matters when it comes to healthcare encounters and how satisfied people feel with these healthcare encounters. Now, another dimension of worldviews is social organization. So, patterns of social interaction, how we interact with people, differ, and this can also affect access to resources. So, is it a hierarchical society in which certain people have access to resources? Is it a more egalitarian society where access to resources is more equitable? Marriage patterns, where people stay after marriage, who do they marry, all of these are factors of social organization. Now, individualism versus collectivism is one of the aspects of social organization. The others here are fate versus free will and communication. So let's now look at individualism versus collectivism first. So the primary difference is that in individualism, the social unit is the individual. Each person has primary responsibility for themselves. They have to make decisions for themselves. Their success as an individual is valued. And a lot of Western cultures are individualistic because people are supposed to be decision makers, they're supposed to work hard, they're supposed to become successful, and that is valued in society. Now, in collectivist cultures, in contrast, the group is the social unit. The group could be a family, it could be a clan, it could be a community, it could be the entire country or nation. And this group has to make decisions for the group as a whole. And it's not the individual success, but it's the group's success that's valued. And you can imagine when you have diverse individuals in a group, some would have to make sacrifices so that the group as a whole can succeed. So the implications are collectivist cultures value avoiding conflict. The decision making may be slower because you are thinking about what is good for the group as a whole and not for the individual. And again, the decisions are being made by a group, and so decision making processes are slower. Now, the implications for healthcare are this: if people are from collectivist societies, they might want to involve other people in healthcare decision making. So, say there is a patient that is being recommended a surgery. In an individualist culture, it's the patient most likely that makes the decision. The patient might ask a close relative, such as a spouse or a child or a parent, for their advice, but basically it's the individual that's making the decision. Whereas in a collectivist culture, it's the group as a whole that's making the decision. So in a collectivist culture, it might be the relatives, the uncles, the neighbors that are all being consulted before healthcare decisions can be made. And this can be crucial because, or this can be important because healthcare providers need to know the culture of the patient, that, healthcare decision making in some cases might just be slower, or they might need to understand that even if the patient is not in agreement, if the family is deciding in a certain way, the patient might feel obligated to go along with that. So these are small dynamics that can affect the healthcare experience, and that is why it's important to understand these. Next, let's look at fate versus free will. So, free will basically means you are in control over your life. You decide the path you have to take, the path is not decided for you. A belief in fate, in contrast, is that your life is subject to events and factors that you cannot necessarily control. These factors could be destiny, it could be spiritual forces, um, ancestors that are making decisions or doing something that affects how your life goes. And so, again, this can have an implication in healthcare. For instance, if you have patients that have a strong belief in destiny, they might not want to go in for aggressive medical treatment because they might think that, despite what they do, their destiny is already made and their life is subject to outside control and not their control. Whereas somebody that believes more in free will might be more willing to go in for surgery or other healthcare treatments because they think that taking that decision can put them in control of their life and that their life is under their control. Finally, let's look at communication. So, in healthcare, it's essential to communicate. Some of the things that we communicate in healthcare are symptoms. So, what's wrong with how we are feeling? What's going on? Is it fever? Is it pain? Is it an ache somewhere? We need to communicate treatments. So, healthcare providers have to tell patients, this is the treatment you should take. And then, of course, there are questions from both sides. Healthcare providers have questions of patients, patients have questions of healthcare providers. So, communication can be verbal or nonverbal. So, in verbal communication, some of the issues that come up with are language. For instance, in the US, about 18% of the population does not speak English at home. And so, if English is the primary mode of communication in a healthcare setting, there can be a problem in communicating. Then, sometimes there are different meanings within the same language. So, for instance, a word that is used as a slang in one language, in English in one country, may have a completely different meaning in English in a different country. And then in medicine and healthcare in general, there's a lot of jargon. And so even if a person understands English well, and if English is the language of communication at the healthcare setting, it might still be very hard to understand the jargon. Now, another aspect of communication is nonverbal communication. So, for instance, posture. Do you stand more loosely, or do you stand at attention when you speak with a healthcare provider? And what does that convey? Does that convey respect? Does that convey discomfort? How fast do you speak? So, Asian cultures tend to not speak as fast as Western cultures do, and speaking fast could be a sign of disrespect in some cultures. Eye contact. Now, the generalization here, and again, remember that there's a difference between stereotyping and generalization. Generalizations means these are some general principles, that they're not necessarily true for every single person. But the generalization is that in Western cultures, people tend to make eye contact. And if somebody does not make eye contact, that person is considered untrustworthy. In Eastern cultures, eye contact might be considered aggressive, and it might be a sign of respect to not look a person directly into their eyes, but to have your gaze a little lower. And so, again, this can be a source of conflict or misunderstanding if eye contact or the absence of eye contact is misinterpreted. Finally, gestures are different in different cultures. So, in this visual, you see a person holding their thumbs up, and this might be considered a positive thing that yes, they are in favor of, they support what you are saying. In some cultures, a thumb is considered a very rude gesture, and it might be interpreted as you actually are being disrespectful to the other person. So again, this was a short video that sought to explain what are worldviews, and within that explain in the difference between individualism versus collectivism. Worldviews are a different concept and a little difficult concept to wrap your head around, but hopefully this has given some examples of what worldviews are and why it's important to know about them in healthcare. Thank you for listening. Have a great day.